patients want to know, what can I do to help myself? And so first thing we should look at is, what can you do to help yourself so you don't need to have an orthopedic surgery? And that goes back to really very simple things. It goes back to weight control. And the less weight we carry, the physics equation of your hip and knee would show that there's less stress across the joint. So in some studies, descending stairs is 4 times body weight. So if you lose 10 pounds, that's 40 pounds less stress on your hip going up and down stairs. So weight control, weight loss is beneficial. If you look at exercise, there's good data that supports low impact exercise as a good way to manage or control osteoarthritis pain. So again, the pool, the stationary bike, the basic science on stationary, or a bike would say that it's only about 1.3%, 3 times body weight when you ride a bike in your hip joint. So very low stress for a very high cardiac exercise. Tai Chi, yoga. Avoid running and jogging. Avoid those high intensity interval training classes that really can put quite a pounding on your joints. Part 2 of that is patients that often ask, well, what can I do to get ready for surgery? If I'm going to have surgery, are there things that I need to do to get myself ready? And there's some stuff that's pretty clear. Patients that have diabetes need to get and have good control of their blood sugar. The best measure that we have to date is probably their hemoglobin A1C, which is a measure of long-term diabetic control. The studies are varied. We have typically in our practice used 7.5 for the A1C as a good indication. If patients are above that, I often ask them to delay their surgeries until we can get better control. That seems to help minimize their risk of complications, and that's anything from infection to heart attack to stroke to pneumonias. And so it seems to be a very important factor in making sure patients have a safe and successful outcome. We look at weight loss. Again, there's been a lot of work done by the American Association of Hip and Knee Surgeons on weight, and there's a pretty clear correlation between a body mass index, which is a measure of how heavy you are versus how tall you are, that once your body mass, your BMI gets above 40, your complication rate starts to go up dramatically. So we really push all of our patients to get their body mass index down below 40 before we consider joint replacement surgery on them. That can be quite difficult for the patients, and many of them are frustrated with that because they're like, how am I to do that with a bad hip or a bad knee? And we have programs that are available through Twin Cities Orthopedics. We have nutritional services that can meet with them. Occasionally we will refer people to bariatric surgeons. We can have them meet with our therapists and have them work on low impact exercise programs to help them with that weight loss strategy. And over the last 3 or 4 years, as we've really drilled down into this, we've actually had pretty reasonable success with that. We look at nutrition. You know, there are studies that show that patients who are malnourished when they go into surgery are at a higher rate for complications, more likely to have delayed wound healing. And so looking at your nutrition before surgery and trying to optimize that is something that's beneficial. There are some studies that we can look at. One's transferrin. There's a total lymphocyte count that can be utilized. If those are below a certain level, having a patient see a nutritionist and trying to get them in a better physiological state can markedly improve their outcome and their recovery. Exercises before surgery to build up strength so that when you're traumatized by the surgery, it's not quite as hard for you to return to walking without a cane. Doing a straight leg raise are beneficial. Smoking cessation is important. I think the data is pretty reasonable that if you can stop smoking greater than about 3 to 4 weeks before surgery, it's going to improve your wound healing significantly. And so that's also something we really try to push our patients to do. Those would be probably 5, 6 of the simplest things that anyone could do to get ready for an upcoming hip or knee replacement surgery.